Thank you so much, everyone, for joining us this evening. My name is Scott Yeager. I am the outreach manager here at Pennie. I'm joined by my partner, Juan Valencia, and we are also joined by Sean Harrington from Representative Frankel's office. And as we set forth, I am going to begin with some words from our representatives. So with that in mind, here we go.
Good evening. I'm State Representative Dan Frankel, and I want to welcome you here this evening. We have a program to help you understand and potentially be able to figure out how to negotiate the Pennie program in Pennsylvania, which is the program that we have that instituted the Pennsylvania Insurance Exchange under the Affordable Care Act to be able to allow people who need health insurance to get it, to get subsidies if you qualify for it. And we have an open enrollment that will be available to people up until January 15th. If you actually need coverage beginning January 1st, you have this evening to do that. But hopefully this informational program today will give you more information and provide the pathway for you to enroll for yourself and your families. So I welcome you here. I hope this is helpful to you. And if you need any additional help or have any additional questions, please reach out to your legislators' offices. For those of you who would like to contact my office, the phone number is area code 412-422-1774. So thank you. Again, I hope this is helpful. And, access to health insurance has been a priority for me since I came into the legislature. This has been one of the tools that enables that. Thank you.
Hey, folks, it's Rep. Sarah Innamorato. Sorry I can't be with you this evening. We're stuck here in Harrisburg. You're about to receive a lot of really valuable information on how to navigate the insurance market. If you have any questions after the webinar, please feel free to contact our office. We're here to help. I hope you have a safe and happy holiday and talk to you soon.
Hi, everybody. Representative Emily Kincaid here. Thank you all for signing on. I know that navigating the insurance exchange can be incredibly difficult. And so we wanted to provide this opportunity for you guys to learn about how to get access to health insurance and get any questions that you have answered. So thank you all for logging on tonight and have a great holiday season.
Hi, this is State Representative Dan Miller. I was hoping to be with you tonight, but we're caught back up on the House floor, so I'm going to have to jump back up. But we are glad that you're here. We're always hoping to try and connect you with resources that matter. Like Pennie, like me, ensure that you and your family have healthcare coverage. We know we're very close, I think, to the deadline for coverage starting on January 1st, but there's still more time for you. You got to get your work done by January 15th, let's just say, no matter what. If you have problems, please reach out to any of our offices. Again, we care about trying to connect you with these great resources.
All right, fantastic. And again, my name is Scott Yeager. I am the outreach manager here at Pennie. I'm joined today also with my partner, Juan Valencia. And as the representatives pointed out, we are here to provide clarity. We're here to provide some encouragement in terms of individuals who may be uninsured, or if you know someone who is uninsured, if somebody is between jobs, if they're starting a small business, if they're out working 2 and 3 part-time jobs, we're here to help. Now, I'm going to start by calling out Pennie for what it is. Pennie, P-E-N-N, you'll see on the screen, you'll see P-E-N-N, that's Pennsylvania. I is insurance, E is exchange. What we do specifically is we help people get protected. Now, before we get into that, I do want to go back in time just a little bit to 2018, which, to be honest with you, that seems so far away. But 2018, in the year 2018, the Commonwealth of Pennsylvania was sending about $98 million a year back to healthcare.gov by way of enrollment fees. And that was so that we had the privilege of using their platform. Now, there were a number of forward-thinking policymakers and legislators from both sides of the aisle in Harrisburg that got together and said, you know what, we can do this better. We can create a competitive marketplace which benefits our customers. We can also create a reinsurance program that acts a lot like the thermostat in your home. It helps regulate the insurance rates and premiums that people pay in the individual insurance market. So for the price of one program, we actually created two programs here in Pennsylvania at zero increase to the taxpayers of Pennsylvania. And ultimately, with a unanimous, bipartisan piece of legislation that passed both chambers of the Pennsylvania General Assembly, Governor Wolf on July 2nd of 2019 signed Pennie into law. And we were born. Now, fast forward to last November 1st of 2020. Pennie launched as the official replacement for healthcare.gov. So if you were to go to healthcare.gov right now and search for individual health insurance, you would be redirected to Pennie here in Pennsylvania. We are the home for high quality insurance options, and we are the only source for financial assistance in the individual health insurance market. And a lot of people ask us, well, what's the difference between me shopping with Pennie or going directly to UPMC or Highmark or Geisinger or what have you? Here's the thing. Pennie's not an insurance company. We are the marketplace. We want to see people get protected no matter what. So if you shop directly through an insurance carrier, fantastic. But here's the thing. Pennie has financial assistance available to help you pay your insurance bill. More on that here in a second. But when I say that we're the home for high quality insurance, please understand that for our friends and neighbors here in the Commonwealth of Pennsylvania who might be between jobs, who might have lost their employer-sponsored coverage, who might not qualify for Medicaid or CHIP, or they might not be old enough yet to qualify for Medicare and Medicare options, Pennie is here to provide access to health insurance that has at the bare minimum, and we have 3 different metal tiers, gold, silver, and bronze. At the bare minimum, all of our plans have the 10 minimum essential health benefits that are set forth by the Affordable Care Act. Things like prescriptions, emergency help, urgent care, hospitalization, obviously, outpatient services, maternity, newborn care, mental health services, substance abuse services. We've got good insurance. We don't permit the sale of junk insurance at Pennie. Here's another thing, especially for our friends and neighbors who've lost their jobs over 2020, 2021. You can't be denied coverage through Pennie because of a pre-existing condition. So if you were in a position before where you had really good insurance through your employer, but you lost your job, well, if you had a pre-existing condition, that'd be something that would weigh on you. The good news is that you can come to Pennie and we can help you. We can help you get protected, okay? Also, with our insurance plans, if you are under the age of 26 and your parent is covered through Pennie, you can remain on your parents' plan until you hit the age of 26. So that's an important thing. Now, in terms of who we help here at Pennie, here's an important thing to keep in mind. And I echoed some of this a little bit earlier, but I really want to drive this home. If you do not qualify for Medicare options, if you're too young, Pennie is an option for you. If you don't qualify for Medicaid or CHIP, Pennie is an option for you. If you're a small business owner, a sole proprietor, a small precision manufacturer, an agribusiness owner, Pennie is an option for you. If you don't qualify for group benefits, we can help you and we can help your employees. On the flip side, we are also very responsive to individuals here in the Commonwealth of Pennsylvania who are between jobs. Everybody at some point in their life, well, I can't say everybody, but most people at some point in their lives, they've received that COBRA letter in the mail from an employer. And after you're waved up off of the floor with smelling salts, you look at that letter and you start looking for options because employer-sponsored coverage is expensive. So it's incredibly important to know that Pennie is here to provide options. And to be quite blunt, we're here to provide hope. We're here to provide hope for people who otherwise would not have hope. So you'll see in the middle of this slide, you will see one of the things that sends a chill right down my spine. And that is that 1 in 20 of our friends and neighbors right now, as we are here, are without health insurance. They go out into the world every day without the protection afforded by health insurance to protect their quality of life. Now, I'm going to add to this and illustrate this really, really clearly here in a moment. But I want people to keep that in mind. There are a lot of our friends and neighbors who opt to go without health insurance. Why? Because they believe that they cannot afford it. Well, guess what? My partner Juan and I have some really good news to share with you about that. So bear with us. I also want folks to know that at Pennie, we have a no wrong door policy. And it's literally something that we take to heart. We believe that the most important thing is for people to be protected, whether you go directly to an insurance carrier or if you qualify for Medicaid or CHIP. We want to make sure that if you reach out to Pennie and it's through our discussion with you, it's determined, hey, guess what? You really qualify for Medicaid or you qualify for CHIP. At that point, we have a warm transfer process, person to person. We will even transfer the application information that you share with us with the Department of Human Services so that you can get protected, because that's what matters. Now, I mentioned that we also have different layers of assistance at Pennie. Number one, there's pennie.com, not pennie.gov, not pennie.pa.gov. It's pennie.com. We're universal. We are accessible to everyone. Okay? You can go to pennie.com. You can actually access your options, determine whether or not you qualify for financial assistance. You can compare and shop plans in your market on your own terms. You're not going to be asked to create an account. You're not going to be forced to share your personal information with us. We are not going to ask you for a social security number, for a phone number, for an email address until you're ready to apply for health coverage. Up until then, you can shop as much as you want. Now, we also recognize that not everybody in this world is born with an inherent knowledge of health insurance. So with that being said, what we offer is through our customer service representatives, and Juan will actually share more with you about this in a minute. But through our customer service representatives, we provide unbiased, no hassle assistance in helping our customers determine what they qualify for in terms of financial assistance. They can comparison shop plans, and ultimately our customer service representatives can help you secure coverage. But here's the thing, keep in mind, our customer service representatives do not work for insurance companies. I can't stress that enough. They are unbiased. They work for you, the Commonwealth of Pennsylvania. So they'll be happy to hear from you. If you reach out to them at 844-844-8040, believe me, they are the people to contact if you want to get connected. But we also realize that not everybody likes to work online. Not everybody likes to talk on the phone. So we have thousands of Pennie certified brokers across Southwestern Pennsylvania who are there to help you not only sit down face to face with a human being, but to sit down with a human being who is, again, our brokers are the only licensed professionals in the Commonwealth of Pennsylvania who can actually take an incredibly complex situation and provide you with a professional recommendation on this is the plan you need based upon your specific healthcare needs, your prescription needs, etc. But in addition to that, within our communities across the Commonwealth of Pennsylvania, we have hundreds of Pennsylvania or Pennie certified assisters, and our certified assisters work for community health centers. They work for clinics, hospitals. They work for faith-based organizations. Our Pennie certified assisters are an incredible resource, especially for people who prefer to work with a resource locally that's unbiased. Well, that's where our assisters come in. Like our customer service representatives, they're going to work with you and for you to help educate you on what decisions are, important to you so that you can make the best decision about your health and dental insurance. I mention all this service to go back to the point that I mentioned in bold not long ago. This heat map represents 607,000 of our friends and neighbors across the Commonwealth of Pennsylvania who are uninsured. That is 1 in 20 people. Now, you take a look at Allegheny County, you'll see 40,900. Westmoreland's 12,000. Washington, 9,600. Butler, 53. Beaver, 6,000. Armstrong, 4,200. The city of Pittsburgh proper is 27,000 uninsured. So I mention all of this because between Juan and myself and the fact that we work for an agency here in Pennsylvania that is 1 year and 1 month old. Let me say that again, 1 year and 1 month old. We need all the help we can get in getting the word out to the communities across the Commonwealth of Pennsylvania about the importance of getting protected. But again, what's the reason that there's so much blue on this heat map? Well, one of the biggest reasons that there's so much blue on this heat map is because people believe emphatically, and who can blame them, that health insurance, and how can I say this? You can have the best health insurance on the planet. It could cover everything. But if people can't afford it, or even worse, if people are granted access to it and they can't afford to utilize it, then what you have technically is a boat on dry land. President Biden on March 11th of 2021 did something to help a lot of people, not just here in Pennsylvania, but across the country. But here in Pennsylvania, because we have our own health insurance exchange, we were able to create a COVID-19 enrollment period to go hand in hand with the American Rescue Plan. We insured a lot of people. Juan's going to talk about that here in a minute. But through the American Rescue Plan for 2021 and 2022, we're in a position where we're able to provide enhanced financial assistance to everyone who applies for health insurance at Pennie. Okay? Before, there was if you were over 400% of the federal poverty limit, which for an individual was like $51,000 a year. For a family of four, it's like $105,000 a year. If you were over that income level, we couldn't help you. Sure, we could make sure that you got connected with an affordable plan, but you would pay full price for it. Now, under the American Rescue Plan, for those individuals who are beyond that 400% of the federal poverty limit, we cap the premiums at no more than 8.5% of the household income. That's significant. That is incredibly significant. And Juan's going to show you here what that means. But what this also means is that regardless of your income level, there has not been another time in the history of the Commonwealth of Pennsylvania where it has been easier and more affordable to get connected with health insurance. With that being said, I'm going to shift gears a little bit, and I'm going to bring in my partner, Juan Valencia. Juan, if you would, let's go over some scenarios where the American Rescue Plan has really helped people achieve not only good coverage, but healthy savings.
Thank you, Scott. And I do want to thanks again everyone that is listening tonight and everyone that has helping us to put together this seminar. Some real examples of the impact of the American Rescue Plan, just to see how the numbers work. Let's see this scenario. This is a single person. He is 40 years old, non-smoker. He lives in Philadelphia County and is making about $19,000 a year. So prior to the American Rescue Plan, this individual was paying $66 a month for health insurance. That's a total of $792 a year. Under the American Rescue Plan, thanks to the financial assistance that we're able to provide with the help of the American Rescue Plan, this individual will pay $0 monthly. So for someone that is making $19,000 to save about $800 a year is important, it's significant. The case of someone having a $0 premium at Pennie is not uncommon right now. More than 50% of our customers are actually having that privilege. So as Scott was mentioning, it's extremely affordable to have access to health insurance. The challenge that we have is that we are new and we need to tell the community, hey, this is happening. If you are eligible to receive financial assistance, you should come to Pennie and get the financial assistance and get the protection for you and your family that you need. Let's take a look at the second example. This scenario is very close to our hearts for our older adults. This is a married couple, 64 years old. They are non-smokers. They live in Dauphin County. And between both of them, they are making $77,000. So they are 64 years old, not yet at 65 to be in Medicare. So a monthly premium for this particular age in health insurance is very expensive. For them was about $2,400 a month. Literally 38.1% of their income is going to health insurance. That's a lot of money for for this particular couple, and many of them. Under the American Rescue Plan, we remember that Scott mentioned that one provision of the American Rescue Plan is to cap that no more than 8.5% of your income should be designated to go to health insurance. So that is applied here. And therefore, this couple will be paying only $550 a month for health insurance. So they will be saving about almost $2,000 a month, or almost $23,000 a year. So as you can see, this is significant savings. And we need to connect with those older adults in Pennsylvania across all the counties. That's actually the big request that we have today, is to make sure that we can connect with these communities that are out there eligible to receive the financial assistance. Our last scenario is this family of 4 non-smokers. They live in Allegheny County, and they are making $52,000. That's their annual income. Monthly premium was $285, almost $3,400 a year. A percentage of their income is 6.52%. Now, under the American Rescue Plan, this family and is receiving financial assistance. So it's only paying now $87 a month. So what's happening? They are saving almost $200 a month that they can locate this money in other priorities that they have. It's a total of $2,300 a year. So this is the type of people that we are helping right now. And if Scott shows the next slide, this is like a big graphic of what's going on with the American Rescue Plan right now in 2021. 50% of our customers, and we have about 337,000 customers before the last few days that actually is, we're going to talk about that, but we got 50% of our customers paying $1 or less a month. That's very significant. And that's thanks to the legislators that had helping us to put together a marketplace in our own state. This is important to tell the community that thanks to the effort of our legislators here in Pennsylvania, they got together and we're able to put marketplace. 68% of our customers are paying $50 or less a month. That's a lot of two. That shows how affordable it is. We have about 65,000 new enrollees in Pennie since we received the customers that were transferred from healthcare.gov to Pennie. And most important is that we have kept about 97% retention customers. That's a pretty high rate to retain customers in any industry. So we have been able to do that until now. People ask, well, where can I enroll in Pennie? Pennie starts every year, an open enrollment in November 1st, okay? And today, December 15th, is a deadline that is a very important deadline for us. Why? Because if you enroll by today, you're able to get health insurance coverage starting in January 1st. Now, if you miss this opportunity, but you're listening to this seminar and you still have a chance to get to Pennie.com and enroll until January 15 next year if you want to start having health insurance in February 1st. So that is important. Now, this is happening every year. Now, outside this open enrollment, outside this period, you may qualify for a special open enrollment period if you have a qualified life event. What are those qualified life events that will allow us to come to the marketplace, Pennie.com, and get the financial assistance and shop for plans at any time during the year? Things like a change in your family. Let's see that you get divorced, or you get married, or you have a new baby. The fact that you're moving from another state to Pennsylvania, or the fact that you're moving from one zip code to another zip code. The fact that you receive or start being lawfully present in the United States. So many people are in this path of citizenship, and they get approved. Let's put it that way. They get approved in June, July. Well, they can come to the marketplace at any time during the year and make sure that they get the financial assistance that they are eligible. Someone that has been in the process of someone lose their job, and therefore the health insurance that was provided before by the employer. So when that happened at any moment during the year, this individual can come to Pennie and make sure that they can enroll. So our education sessions will go over the entire year. Scott and I literally are meeting with thousands of different people and organizations across the state, because we want to make sure that, you know, if people can enroll during the open enrollment, wonderful. But if they miss it, that they understand that there are some important options in those communities, so they can next time around when something happens or triggers a special open enrollment, they are ready and they can come to the marketplace. Again, our help is free. We are state employees. Our literally goal is to serve the individuals here in Pennsylvania. So we focus on customer service. For that, we have a very good team of in our call center, literally more than 260 people working with us, receiving a daily average of 4,000 calls. Some of them speak Spanish, so they can literally attend Spanish-speaking customers, but we still have a language access line that will allow us to translate up to 240 different languages. And, you know, we have a diverse population in Pennsylvania. So we have that in our call center. Very good customer service. We're proud of that. We do have two important networks. One, our brokers, or those insurance agents that are in your community. If you go to pennie.com, and the bottom of our website, there is find a broker near you. And you put your zip code there. Literally, you will see listed all these insurance brokers that are licensed in Pennsylvania that can schedule a virtual meeting with you, or you can actually go to their offices and they will be able to explain anything to you, any options. So brokers are very important in our community because they are able to help us to reach out many communities and many people that otherwise would be very difficult for us to get there. So, but also an important network that we have are our assisters, our certified assisters, Pennie assisters. They usually work for nonprofit organizations or health centers, local hospitals. Okay, these people work in outreach or social workers, and they are unbiased. So they can literally help you to see how you can enroll in Pennie, answer any questions that you may have. But at the end, what we want to make sure is you take the beauty of Pennie, and the beauty of Pennie is that you can choose different options for health insurance plans. Pennie as marketplace create this space of good competition between these insurance companies that trying to do the best in their health plans and compete also to lower their rates. So that's also important. Finally, if you have any questions, just go to pennie.com and send us a question. For sure, we will reply, we will answer. Again, our focus from top to the bottom in our agency is focused on customer service. Just to make sure that we, I'm sorry, Scott, just to make sure that we repeat the phone number that we have is 1-844-844-8040. You can find the phone number in our website. Today, because it's a deadline, Pennie Call Center will be open tonight until 10 p.m. Again, our phone number is 1-844-844-8040.
Fantastic, Juan. And if if you could just indulge me for a second, what I'd like to do is I'd like to introduce everyone to Pennie.com. This is our website. As you saw when I first accessed the site, there was a pop-up that came up that said, you know, hey, we've got extended call center hours tonight. Why? Because it's the deadline and we want to help get everybody protected who calls in. But as Juan mentioned, our call center number is right here in the upper right-hand corner. It's never far away. Help at Pennie is never far away. In fact, we have a support tab where you can connect with us. And when you're connecting with Pennie, you can connect with the call center. You can find a broker. In fact, if we took a look right now for a broker, 15127, I think that's a Pittsburgh zip code. I'm gonna give it a shot and see. Yeah, there we are. 15127 within a 5-mile radius of 15127. And again, I understand that's not the only Pittsburgh zip code, but just to give you an idea, you have 26 different Pennie certified agents. And some of the agents, they can work with you on health, dental, vision, Medicare. If you're in that population where about 36%, just to let you know, about 36% of Pennie's current customers are between the age of 55 and 64. Why? Well, because as Juan showed you, there is significant savings to be had for individuals right now who fall in, you know, that range where they're not old enough yet to, you know, age into Medicare or Medicare options. But we also have multiple languages. Here's an agent that speaks English, Chinese, and Mandarin. We also have individuals that can help you not only with health and dental, but they can help you with vision. They can help you with life insurance. I show you this just to sort of drive home the point that, again, you are never alone and without support when you're on Pennie.com. I do want to very quickly and to be respectful for everyone's time. I do want to go and go back to Pennie.com very quickly and show you down here, down here in the lower right-hand corner, you will see that Pennie.com as a website has the ability to translate into 10 different languages. Right now, I'm feeling a little Russian. So let's click on Russian and you'll see that Pennie will actually translate the site into Russian. Okay. And we can do this with Mandarin Chinese. We can do this with Vietnamese. We can do it with multiple languages, French, what have you, Spanish. But I point that out because that's one of the facets that we're very proud of here at Pennie, is providing a website and a call center experience that gives somebody the ability to approach the subject of health insurance, which is very complex, which is very complicated, which can be very frustrating, in their primary language. Nothing is more frustrating than having to wrestle with something as complicated as health insurance when English is not your primary language. To be able to approach it from the vantage point of your primary language is something that's necessary. In fact, we consider it requisite here at Pennie. So we do our best. I do want to go up here very quickly to the Get Covered button. You'll see this gold Get Covered button everywhere on Pennie. Why? Because this is where you actually start the process of finding out what you would be eligible for. You remember I said before that you don't have to provide us with an account. You don't have to set up an account. You are not going to be required to provide us with your social security number, phone number, email address, etc. Well, I'm about to show you where the rubber hits the road. So here we go. You click on Browse for Health and Dental Plans. This is Pennie's shopping comparison tool. You can use this. You can use this helping a friend. You can use this helping someone in the community. You can utilize this for anyone who comes to you and says, I don't have insurance. Well, if you click continue here, the first thing that we'll ask for is the plan year. Okay. And right now we're getting everybody ready for 2022. You put in your zip code. That's it. We're in Allegheny County, 15127. Put in your birth date. We're going to say 1985. That was a good year. Anybody who is seeking coverage gets a blue check mark. You can add a spouse. You can add dependents. And again, anybody who is seeking coverage gets a blue check mark. Okay. We'll put in 27,000 for income. Off to the right-hand side, the first thing that you see light up is see if you qualify for savings. Why? Well, going back to what matters most is people want to know, can I afford the health insurance? Well, we're about to answer that question here. This particular individual in Allegheny County would qualify for $263 a month in advanced premium tax credits that would lower their monthly cost in terms of health insurance. Okay. Now, this individual also qualifies for cost sharing reductions. And you remember I said we have 3 different metal tiers here at Pennie. We have gold, silver, and bronze. If this individual were to opt to purchase a silver plan, they would actually qualify for reduced coinsurance, deductibles, co-payments, the things that really make you want to yank hair out of your head. So with that, this is where the cost sharing reductions come into play. Now, you'll also notice here at Pennie, anytime you see something that's underlined, you just need to hover over it. And if you don't know what coinsurance is, this will define it for you. This will tell you what coinsurance is. If you don't know what copays are, this will define what a copay is. So keep that in mind as you compare plans. Now, for the sake of time, you can go through here. You can actually add specific doctors, specific dentists, specific prescription drugs, and we'll be able to identify health insurance plans that will help you connect with not only your family doctor, your family dentist, but the prescription and maintenance medications that you need as being part of your healthcare regimen. For right now, we're going to take a look at the plans because, again, I see we're coming up on time here. These plans are real time. For an individual who met the criteria that we entered, there are 52 health insurance plans. We're going to sort these plans by metal tier and cost. You'll see here where you have bronze plans, Highmark, UPMC, etc., that are very low cost. But let's say, okay, we want to take a look at gold plans. They're generally the best of the best. Here's a gold UPMC HSA EPO, $5.73 a month. You have a Highmark plan right here for $32. It's a gold EPO. And yes, that's not an error. That is actually a $0 deductible. So when you review these plans, you'll see a lot of benefit, not only in the cost of these plans, but the quality of these plans. And you can compare. Let's say we want to take a look at a PPO, okay? So we click on this UPMC PPO. We're going to go to the next page and see, okay, right here, here's a Highmark PPO. We want to go in and we want to actually compare these two plans together. Well, guess what? Here they are. And remember what I said. Anything you see, any element that you see that's underlined, you can hover over it. If you don't know what PPO means, you can hover over it, and this will tell you. It means Preferred Provider Organization. Pennie will actually help educate you on what your options are. Now, we can look down through here and compare these plans. In terms of deductible, the UPMC plan has a $3,100 deductible for an individual. The Highmark plan has a $0 deductible. Separate drug deductibles, again, included in the deductible. So that's included in the $3,100, $0 for Highmark. Out-of-pocket maximum, $4,000, $7,500. Those are things that are important to consider, but there's also other things that are important. Whether or not you're covered for certain drugs, and if so, how much? What does it cost for a doctor's visit? Okay. In some cases, mental health and behavioral health services are critically important. Substance abuse disorder services are important. Pregnancy, newborn care. And of course, there are other services that cover everything from skilled nursing facilities to acupuncture to well baby visits to even emergency eye and dental for children. So children's dental and vision are covered here. Speaking of dental and vision, Pennie does not cover, we sell health plans and we sell dental plans. We do not sell vision plans. Now, a question that we get, does that mean that vision is not covered under a health insurance plan? Well, it's emergency vision, okay? What I mean by that is if you injure your eye, say you're out in the garage and you're working on something and, something flies up and it hits you in the eye. Well, that's a medical condition. At that point, you're covered. On the backside, if you're thinking about contacts, eyeglasses, vision visits or vision exams, things like that, no. Vision insurance is not covered through Pennie, okay? But dental insurance most definitely is. So it's important to know that we have very affordable dental programs. And some of our dental programs even cover things that are incredibly important, like braces and orthodontia, things like that for parents who, may have dependents who are in that age where they're going to need, access to those things. But I did, like I said, I wanted to take a couple minutes just to share with you a little bit about Pennie, about Pennie.com, and the fact that we do have, again, as Juan pointed out, today is our last day to enroll for January 1, 2022 coverage. However, we know not everybody's going to make today's deadline. So tomorrow, as a state-based exchange, we are in a position where we can add an additional month to our open enrollment, and that's exactly what we do. Here in Pennsylvania, from December 16th to January 15th, you can apply and secure coverage for February 1 of 2022. And as my partner Juan mentioned, you can also, throughout the course of the year, if you have a qualifying life event, come to Pennie. Visit Pennie.com, call 844-844-8040, and we'll be in a position where we can help you get protected. So with that being said, I am going to go ahead and, call out to folks if you, there we go. If you have questions, please feel free to ask your questions, and Juan and I will be happy to answer any question that you might have. And if you don't have any questions right away, that's okay. Keep in mind that we're not going anywhere. But again, if you need anything, if there's anything that we can help with, don't ever hesitate to reach out. That is what we are here for. And thank you to all the representatives who provided us with the opportunity to reach folks in southwestern Pennsylvania. And on behalf of my partner, Juan, myself, and the folks that we work with here at Pennie, thank you so much and have a peaceful evening.